Have you ever wondered how well your heart is functioning and what you could do to improve its health? This question might seem simple, but it's one that many of us don't often stop to consider. Yet, it's crucial. The heart is the engine that keeps our bodies running, tirelessly pumping blood through our veins to nourish every cell, every organ, and every system. But what happens when this engine starts to falter? When the heart isn't in its best shape, the entire body feels the impact. That's why understanding heart health is so important. It's not just about the heart itself, but about our overall well-being. Now let's delve a little deeper. The heart is a complex organ, and many factors can influence its health. It's not just about genetics or age, though those certainly play a part. A host of lifestyle choices can also affect the heart, from what we eat and drink, to how much we exercise, to the ways we manage stress. The good news is, many of these factors are within our control. By making conscious choices about our habits and behaviors, we can significantly influence the health of our hearts. And it's not just about preventing problems, but also about maintaining a high quality of life. A healthy heart can mean more energy, better sleep, and a greater capacity to enjoy the things we love. But here's the catch. To make these positive changes, we first need to understand the heart and its workings. We need to know what can go wrong and how to recognize the signs when something isn't right. We need to be aware of the risks and understand how to mitigate them. This is where we come in. Over the next several minutes, we'll be taking a deep dive into the world of heart health. We'll explore the causes of heart attacks, the symptoms to watch out for, and the steps you can take to prevent them. We'll discuss the treatments available and look at the importance of early intervention. So, are you ready to embark on this journey? Because after all, understanding the heart, how it functions, and what can go wrong is key to maintaining good health. So, what exactly is a heart attack? Well, that's an excellent question. A heart attack, also known as a myocardial infarction, occurs when the blood supply to a part of your heart is blocked, usually by a blood clot. This blockage can damage or destroy part of the heart muscle, affecting its ability to function effectively. Now let's dive a bit deeper. Your heart is a muscle, and like any muscle, it needs oxygen to work. This oxygen is delivered to the heart by the coronary arteries. When these arteries get blocked or narrowed, the heart can't get the oxygen it needs. This blockage is often caused by the buildup of fatty substances, like cholesterol, in the arteries, a condition known as atherosclerosis. Imagine your arteries as a highway. Now picture a traffic jam on that highway, caused by an accident or construction. The cars behind the blockage can't move forward, right? That's essentially what happens during a heart attack. The blood, which is like the cars, can't get past the blockage to deliver oxygen to the heart muscle. If this blockage isn't cleared quickly, the part of the heart that is deprived of oxygen begins to die. The longer the blockage is left untreated, the more damage is done to the heart. This is why it's so important to recognize the signs of a heart attack and seek immediate medical attention. It's also worth noting that heart attacks can vary in severity. Some people might have a mild heart attack, where only a small part of the heart is damaged. Others might have a major heart attack, where a large part of the heart is damaged or even dies. In either case, a heart attack is a serious medical emergency that can lead to serious complications or even death, if not treated promptly. It's not something to be taken lightly or ignored. To put it simply, a heart attack is a life-threatening condition that happens when the blood flow that brings oxygen to the heart muscle is severely reduced or cut off completely. A heart attack is a serious medical emergency that requires immediate attention. Now that we know what a heart attack is, let's explore what causes it. Heart attacks occur when the flow of oxygen-rich blood to a section of heart muscle is blocked. The most common cause of this blockage is a buildup of fatty deposits or plaques in the coronary arteries. This condition is known as atherosclerosis. Over time, these plaques can harden and narrow the arteries, restricting blood flow to the heart. If a plaque ruptures, it can lead to the formation of a blood clot, which can block an artery and cause a heart attack. Another cause of heart attacks is coronary artery disease, the most common type of heart disease. This condition develops when the coronary arteries become damaged or diseased, usually due to atherosclerosis. When the coronary arteries are narrowed or blocked, the heart doesn't receive enough oxygen, leading to a heart attack. In addition to these medical conditions, lifestyle factors can significantly increase the risk of heart attacks. One of the biggest culprits is an unhealthy diet. Consuming high amounts of saturated fats, trans fats, and cholesterol can contribute to atherosclerosis. Similarly, A lack of physical activity can lead to obesity and high blood pressure, both of which can increase the risk of heart attacks. Smoking is another major risk factor. The chemicals in tobacco can damage the heart and blood vessels, leading to atherosclerosis. Moreover, nicotine in cigarettes reduces the amount of oxygen that the heart gets, while at the same time increasing heart rate and blood pressure. This puts additional stress on the heart and can lead to a heart attack. Excessive alcohol consumption, stress, and drug misuse can also increase the risk of heart attacks. These factors can raise blood pressure, damage the heart muscle, and lead to other heart conditions that can result in a heart attack. Understanding the causes of heart attacks is the first step towards prevention. So it's crucial to maintain a healthy lifestyle and get regular checkups, especially if you have a history of heart disease in your family. Recognizing the signs of a heart attack can save a life. So, let's delve into the common symptoms and warning signs of a heart attack. The most common symptom is chest pain. This isn't an ordinary discomfort, but a profound ache that feels like pressure, fullness, or squeezing. It's as if an elephant has decided to sit on your chest. It's important to note that this pain can come and go, and sometimes it might not even be intense. Now, let's talk about shortness of breath. This can happen with or without chest pain. Imagine gasping for air, panting as if you've run a marathon, even when you're at rest. That's what shortness of breath feels like when it's a symptom of a heart attack. Next, we have discomfort in other areas of the upper body. This can include the arms, the back, the neck, the jaw, or the stomach. It can feel like a tight band around the area, a heavy weight on it, or an unpleasant pressure. Then there are less common signs that we should also be aware of. These include breaking out in a cold sweat, feeling unusually tired for no apparent reason, nausea, and lightheadedness. One key point to remember is that symptoms can vary. Not everyone who has a heart attack experiences the same symptoms or even the same severity of symptoms. Some people have mild pain, others have more severe pain. Some people have no symptoms at all, which we call a silent heart attack. Regardless of the type or intensity of the symptom, if you or someone you know experiences any of these signs, it's crucial to seek medical attention immediately. Don't wait for the symptoms to pass or get better. Time is of the essence when dealing with heart attacks. The sooner you get treatment, the better your chances of survival and recovery. So remember these signs: chest pain, shortness of breath, discomfort in the upper body, cold sweat, unusual fatigue, nausea, and lightheadedness. Knowing the symptoms of a heart attack can make all the difference. While heart attacks are serious, there are treatments available and steps you can take to prevent them. Let's delve into the various treatments for heart attacks, starting with medications. Doctors can prescribe a range of medicines like aspirin, thrombolytics, antiplatelet agents, and others. These work in different ways to either break up blood clots, prevent new ones from forming, or reduce strain on the heart. If medications aren't enough, surgical procedures might be necessary. Angioplasty, for instance, uses a small balloon to widen blocked arteries, often coupled with the insertion of a stent to keep the artery open. In more severe cases, bypass surgery might be needed, where a surgeon creates a new pathway for blood to reach the heart muscle. But let's not forget, treatment isn't just about what happens after a heart attack. It's also about making lifestyle changes to prevent future heart attacks. A healthy diet is crucial. This means eating plenty of fruits, vegetables, lean proteins, and whole grains. It's also important to limit intake of saturated fats, trans fats, and cholesterol, which can all contribute to heart disease. Exercise plays a significant role too. Regular physical activity can lower your risk of heart disease by keeping your heart and blood vessels in good condition. Aim for at least 30 minutes of moderate intensity exercise most days of the week. And of course, smoking is a major risk factor for heart disease. If you smoke, quitting is the best thing you can do for your heart health. And if you don't smoke, well, don't start. Remember, these lifestyle changes aren't just for people who've had a heart attack. They're for everyone who wants to reduce their risk. It's about making long-term commitments to your health, because the best treatment is, without a doubt, prevention. With the right knowledge and actions, it's possible to reduce the risk of heart attacks. So take charge of your heart health today, and make the changes that can keep your heart beating strong for years to come. Today we've learned a lot about heart attacks, from what they are to how to prevent them. It's been a journey of discovery and understanding, one that has shed light on a health issue that affects millions globally each year. Let's quickly revisit what we've discussed. A heart attack, also known as a myocardial infarction, is a serious medical condition that occurs when the blood supply to part of your heart is blocked. This blockage, often caused by a buildup of fatty substances, can damage or destroy part of the heart muscle if not promptly treated. We also delved into the causes of heart attacks. Chief among these are lifestyle factors, including an unhealthy diet, lack of physical activity, smoking, and excessive alcohol consumption. Other causes include certain medical conditions such as high blood pressure, high cholesterol, and diabetes, as well as genetic factors. Symptoms of a heart attack can vary and may not always be severe or obvious. They include chest pain, shortness of breath, feeling lightheaded or dizzy, and experiencing nausea or cold sweats. It's crucial to seek immediate medical attention if you or someone else displays these symptoms. Treatment for a heart attack often involves medication, lifestyle changes, and sometimes surgical procedures. But prevention is always better than cure. We can reduce our risk of heart attacks by adopting healthier habits. This includes eating a balanced diet, regular exercise, avoiding tobacco, and limiting alcohol intake. Regular health checkups can also help detect any potential issues early. In conclusion, heart health is a topic that should concern us all. It's not just about avoiding heart attacks, but about living healthier, fuller lives. By being informed and proactive, we can make a significant difference to our heart health and overall well-being. By making simple changes to your lifestyle, you can keep your heart healthy and reduce your risk of heart attacks. Remember, your heart is in your hands.